as we are working in health sector, you can advise a lot.
Yes.
What all Thrissur Red Cross can do or Kerala Red Cross can do in the field of health. IMITയിലേക്ക് സ്വാഗതം.
വെൽക്കം.
അന്നദാത വെങ്കട സുബ്രഹ്മണ്യൻ ഡോക്ടർ ഇന്ത്യൻ റെഡ് ക്രോസിൻ്റെ 28 വർഷം ഇന്ത്യൻ റെഡ് ക്രോസിനെ ആന്ധ്രാപ്രദേശിൽ നെല്ലൂർ എന്ന് പറയുന്ന ജില്ലയിൽ നയിച്ച ആളാണ് താങ്കൾ. ഒരു ഡോക്ടർ എന്ന നിലയിൽ താങ്കളുടെ വൈഫും ഡോക്ടറാണ്, മകനും അറിയപ്പെടുന്ന നെഫ്രോളജിസ്റ്റാണ്, അപ്പോളോ ഹോസ്പിറ്റലിൽ വർക്ക് ചെയ്യുന്നു. ഇന്നലെയാണ് സാറ് ഫോണിൽ എന്നെ നേരിട്ട് പരിചയമില്ല, ഇന്നലെ ട്രിവാൻഡ്രം റെഡ് ക്രോസുമായിട്ട് ബന്ധപ്പെട്ട് ജില്ലാ ചെയർമാനെ കാണണമെന്ന് പറഞ്ഞത്. ഇന്ന് എൻ്റെ ക്ഷണം സ്വീകരിച്ച് സാർ വന്നിരിക്കുകയാണ്. സാർ വന്നതിന് വളരെ നന്ദി. സാറിൽ നിന്ന് ആന്ധ്രാപ്രദേശിലെ ആദ്യത്തെ ബ്ലഡ് ബാങ്ക് രൂപീകരിക്കാൻ നേതൃത്വം നൽകിയത് സാറാണ്. സാമൂഹ്യ സേവന രംഗത്ത് ധാരാളം കാര്യങ്ങൾ സാർ ചെയ്തിട്ടുണ്ട്. ഹെൽത്ത് സെക്ടറിൽ, ആരോഗ്യരംഗത്ത് ധാരാളം കാര്യങ്ങൾ സാർ ചെയ്തിട്ടുണ്ട്. അപ്പോൾ സാറിൻ്റെ ഉപദേശം ഞങ്ങൾക്ക് തീർച്ചയായിട്ടും മുതൽക്കൂട്ടായിരിക്കും. റെഡ് ക്രോസിൻ്റെ ജില്ലാ ചെയർമാൻ എന്നുള്ള നിലയ്ക്കും IMIT ഇതൊരു IT കമ്പനിയാണ്, പക്ഷേ ഞങ്ങളും സാമൂഹ്യ സേവനത്തിൽ വളരെ തൽപരരാണ്. ഞങ്ങൾ ഡേ ഡ്രീംസ് എന്ന് പറയുന്ന ഒരു ഓർഗനൈസേഷനുമായിട്ട് ഞാൻ സാറിനോട് നേരത്തെ പറഞ്ഞു, സ്പെഷ്യലി ഏബിൾഡ് കിഡ്സിന് വേണ്ടിയിട്ട് വലിയൊരു പ്രൊജക്റ്റ് ഞങ്ങൾ ചെയ്യുന്നുണ്ട്. അത് വേൾഡ് വൈഡ് പ്രൊമോട്ട് ചെയ്യുന്നത് ഞങ്ങളാണ്. ഇപ്പോൾ ഏറ്റവും ഒടുവിൽ കവച് എന്ന് പറഞ്ഞിട്ട് ഡൈമെൻഷ്യ, അൽഷിമേഴ്സും ഒക്കെ ബാധിച്ച ആളുകളെ വേ ബാക്ക് ഹോം എന്ന് പറഞ്ഞിട്ടുള്ള വലിയ പ്രൊജക്റ്റ്, അതും വലിയ ഒരു അംഗീകാരം ലഭിക്കാൻ വേണ്ടി പോവുകയാണ്. അതും പൈലറ്റ് ചെയ്യുന്നത് ഞങ്ങളാണ്. അപ്പോൾ ഞങ്ങൾക്കും ഈ സാമൂഹ്യ സേവന രംഗത്ത്, എനിക്ക് വ്യക്തിപരമായിട്ടും ഞങ്ങളുടെ കുട്ടികൾക്കൊക്കെയും ഈ രംഗത്ത് പ്രവർത്തിക്കാൻ വലിയ താല്പര്യമാണ്. അപ്പോൾ സാറിനെ പോലുള്ള ഒരു വിശിഷ്ട വ്യക്തിത്വം, രാഷ്ട്ര സേവനത്തിനുള്ള അവാർഡ് ലഭിച്ചിട്ടുള്ള ഒരാൾ, നിരവധി വട്ടം മികച്ച റെഡ് ക്രോസ് പ്രവർത്തകനുള്ള അവാർഡ് ലഭിച്ചിട്ടുള്ള ആൾ, രാഷ്ട്രപതി ആയിരുന്ന അബ്ദുൽ കലാമിൽ നിന്ന് പോലും അവാർഡ് വാങ്ങിയിട്ടുള്ള ഒരാൾ, അങ്ങനൊരു ബഹുമുഖ വ്യക്തിത്വം ഈ 80-ാം വയസ്സിലും ഊർജ്ജസ്വലനായിട്ട് ഇങ്ങോട്ട് കടന്നു വരുമ്പോൾ അങ്ങയെ എനിക്ക് എത്ര അഭിനന്ദിച്ചാലും മതി വരില്ല. സർ, we are very grateful to you for having come over here, and let us have a talk on health issues, and as we are working in health sector, you can advise a lot.
Yes.
What all Thrissur Red Cross can do or Kerala Red Cross can do in the field of health. Sir, please start with.
Okay. Start with, we'll discuss it.
Okay. Let us have it as a discussion. So you told that you were the person who established first blood bank in Kerala. In Kerala, there is no blood bank for Red Cross. You told that there are so many institutions under Red Cross in Andhra Pradesh,
Yes.
including cancer center, no?
Cancer, only center in India, I think so.
Only cancer center in India run by Red Cross.
Yes.
I am a person who wish to have organizations or institutions like that under Red Cross. I am a person who wish to open. I am a dreamer who dreams such things, because poor people, whenever we come across 2 or 3 people or 5 people, 1 or 2 is affected by cancer. Earlier we were talking about dialysis. Sir was telling there are steps to prevent dialysis.
Yes.
Sir was telling there are steps to prevent cancer. What all are the steps? What can be done? Prevention is better than cure, no?
Yes.
What we can do? And Sir was telling about motivators to contribute blood. So one wonderful idea you had put forth before me is that I personally, being the district chairman, I have got 20,000 JRC volunteers, junior Red Cross volunteers. Unfortunately, they are below the age of 18. Sir was telling a wonderful idea of conducting a blood group determination camp at schools. And in front of them, their teachers would give blood. Donate blood. And that will be a motivation for them when at the age of 18, they will be rushing forward to come forward with blood. And India is a place, or Kerala is a place where the requirement is not met, yet people are not contributing. Sir was telling, being a doctor, you are telling that almost 5 liters of blood are there with an adult.
4 to 5 liters.
4 to 5 liters. And only 400 milli is taken. 350 to 400 milli. And it will be made up within 3.
That including protect, that is anticoagulant.
Yeah, anticoagulant. And it will take only just 3 weeks, 3 months.
No, if after donating blood, to come back to the normal, it will take 4 weeks. We are giving additional 2 months rest. So once in 3 months, anybody can donate blood.
And once in 3 months means a person, an individual, who has no other health issues,
yes,
can contribute at least 4 times a year, no?
Yes.
And if such a motivation is given, you are the best motivator. I have not seen such a motivator. You say the age is not a problem. India is permitting blood donation up to the age of 65 now.
Yes, no.
65. And if everybody is ready to contribute or donate blood, there will be no scarcity of blood, no?
Yes, that's true.
The requirement will be met.
Need not be at least 20% of the population if they donate is sufficient.
But unfortunately, there is a lack of knowledge, or there is no
knowledge, because of fear they don't donate.
Yeah. Is there anything to fear about it?
Yes, it is. There is no fear. But if when we are donating, if our children are seeing while donating, they may, in future generations, that fear may go away.
Yeah. That is what Red Cross could do, is that
Yes.
motivate people, no?
Yes, motivation.
Motivation. And when we
Getting away the false notions.
and is there any problem for girls to donate blood?
Yes, why not? They can donate.
They are afraid that after puberty there is menstrual cycle, no?
Yes.
And in the menstrual cycle they lose a lot of blood. They are afraid that
No. They never,
is there any connection between this menstrual cycle, loss of blood, and
I'll tell you.
Okay.
They never lose excess of blood. If they are losing excess of blood, they will come in clots. That is a disease.
Okay.
During periods, what they are losing is unclotted blood. Not naturally limited for it will be for 3 days. Will be all blood. Most important is weight of the donor, and hemoglobin percentage is more important than others.
Weight of the donor.
Yes, there should be minimum.
He or she should be about 45 kgs.
45 kg. Hemoglobin should be 12.5 grams above.
Okay. And that all procedural tests are done before the donation, no?
Yes, weight they have to compulsorily they will do. They ask any previous any illness and all the things they will ask. They will check the hemoglobin. Then only they will take blood.
Okay. No problem in girls donating.
No problem. See one thing, because not only due to periods alone, as it is they are diet conscious. They never take iron-rich food.
Yeah.
So instead of you are unfit, instead of by saying you are unfit, you can give some iron tablets for 2-3 months. Let them come donation after 3 months. They will have positive approach, they are negative approach. If they are coming here, they are unfit to donate blood means they will have they are depressed. Instead of that one, if you are giving 3 months iron tablets, you can come for donation after 3 months. So they will be better.
So I have seen some girls, especially, they are like less blood, like what we say, whitened.
Anemia.
Anemia. And what is the reason for it?
There may be so many reasons. Dietary, maybe due to disease or due to worm infestation, so many causes.
Okay.
So it is like that, If you give even blood, iron, anything. If the tap is open, there is no use. You must diagnose for the cause of anemia. Treat that. So many conditions unwelcome anemia. But in our country, most of the cause is nutritional anemia.
Nutritional anemia.
In our country, major.
That is major shortness is iron.
Iron, yes. Yes.
And the simple formula is to supply iron tablets.
Iron tablets and dietary also. Beans, green vegetables.
Green vegetables.
Yes.
Green vegetables means
In Telugu we call it akukurlu. That is leafy vegetables.
leafy vegetables. Okay. This cheera and all.
Yeah.
Okay. Nowadays, what happens is that is there any connection between non-veg and veg?
No.
You being a Brahmin, you never has gone for non-veg, no? And you
Sometimes I may be taking egg. Sometimes
iron
egg.
egg. Okay. In Calcutta, I have heard that Brahmins use
Fish.
this fish.
Yes.
And they
They have their own ponds in their houses.
Yeah, I have ponds in their houses and they eat this fish, no?
Yes.
Malsya puchpam, they say.
Yes.
Fish flower. And you had no problem to eat eggs, no?
No problem.
Oh, no problem. Okay. Egg is also treated as vegetarian in some parts of the country.
Because we are not hurting killing the.
Yeah.
Now, these eggs will not reproduce chicken.
Yeah.
These eggs, present eggs, they never reproduce.
They never produce. Okay. Artificially made, no? Artificially
Not
made
artificially.
in.
That is, we can say, they cannot reproduce again. Yeah.
Okay.
Kitchen.
Not harmful also.
Chick.
Okay. Sir, you were telling me sugar, BP and cancer are killers. Silent killers.
Yes.
And is there any remedy
Yes.
for you are talking to the youth of Kerala.
Yes.
We at IMIT represent the youth of Kerala. Though I am 57, the average age of IMIT employee is 23. So, what is the precaution that they should take that they are not affected by these silent killers?
See, silent killers in the sense, if you go to corporate hospitals who are having dialysis, who have got paralytic stroke, loss of vision, amputation or heart attacks, at least more than 50% are diabetic and hypertensive. That can be prevented. That's why I say I do one thing. In my practice, if any patient comes above 25, whether they are coming for any suffering, whatever first I will check their BP and sugar. See, generally, for majority of so many NGOs or so many people, they start medical camps. They conduct medical camps. I believe it is medical camps are mere waste. Why? I think because that is only for publicity. Suppose if I go to a doctor, it will take some time, at least 10-15 minutes to take the history and all the things. Is it possible in a camp? It is not possible. That's why if at all they are going to conduct camps, camp can be conducted by a general practitioner. They have to identify whether to refer to neurologist or cardiologist or anybody. Then the team will be very less. Those people can be referred to the doctor so they can get a quality of treatment. Instead of that one, what I suggest, without any expenses, adopt some village. Check blood sugar and BP for every person above age of 25 years, but a nurse need not have a doctor.
Above the age of 25, we should go for
Better.
Examination of
some
BP and
people,
sugar.
Some people may have primary hypertension or even younger age also.
Okay.
Better to go about 25 years.
Just engage some nurse or something.
Pardon?
Just engage some nurses. Some nurse only.
Yeah, some.
Nurse can do it.
Needs.
Nurse, no?
I don't know.
The lady nurse or male nurse.
No, nurses. No. Any nurse.
Any
or
nurse can do
technician.
it.
nurse or blood bank technician to do blood group 1, other BP.
Okay.
So out of them, we may get around 20% may be positive. If we treat them, we can prevent the disease, and corporate hospital expenses can be minimized without any suffering. Regarding the cancer, I can tell you, see, cancer, not only this one, prevention from by birth, I will tell you. After having delivery, giving breastfeeding within as early as possible is very important. That gives a lot of immunity. Then people give vitamins and all these things. That is not necessary. See, that vitamin drops may contaminate and may cause diarrhea. So mother milk, if they are given at the not only timely, whenever child cries, they can give it. After 6 months, you can give supplementation. Then you can give liquid, all those things.
Up to 6 months, this
Mother milk is
sufficient.
more than sufficient.
More than sufficient.
No need of, if they are giving mother milk, there is no need. Suppose if they are giving cow's milk, the iron is necessary. But ass milk is as good as similar to mother's milk.
Which milk?
Ass milk, ass.
Oh yeah.
Ass milk is.
I have heard about it, but for the first time I am hearing from a doctor.
Yeah.
This ass milk is good as good as.
Not as similar to mother's milk.
Okay. Similar to.
Similar to mother's milk. So
Means as good as.
We can say. If you are giving buffalo milk, it is fat will be just diluted. That is a different thing. Then you require vitamins and all this. Otherwise, not necessary.
The best thing is breastfeeding, no?
Yes. Then immunization is also equally important. Vaccination, timely vaccination. People who government is giving free of cost, any special vaccinations, they can go for outside. After vaccination, diet is very important.
There are vaccinations to prevent cancer?
For cervical cancer.
Cervical cancer, okay.
For cervical cancer.
These girls should take it.
After maturity, before marriage is ideal.
After puberty.
After puberty.
Puberty and before marriage.
Ideal.
Ideal.
After marriage also they can have, but they should not be pregnant. So elderly woman can.
By vaccination, we can make sure that there is no cervical cancer.
Yes, you can prevent cervical cancer.
That's great.
And
this colon cancer.
No, let me complete this. Elderly women can have pap test to diagnose cervical cancer as early before getting involved. Staging can be done.
Okay.
And prostate cancer.
Okay.
So prostate cancer is seen only among males. That's why males who want to prevent it, they can have pap test after 60. I am a prostate cancer patient. I detected early. I am quite healthy.
And prostate cancer, while we were talking earlier, sir told me that when urination becomes frequent,
that may be benign prostate, need not be prostate cancer.
Might be due to
above 80 years, 5 in 100 will get prostate cancer.
Oh. Above 80. My father was detected with his prostate enlargement, but the doctor advised not to go for surgery.
No, there are good medicines.
Medicines.
Yes.
And frequent urination in the night.
Maybe due to diabetes also.
Maybe due to
diabetes. Or urinary infection also.
They hardly urinate, no?
That is maybe due to prostate infection, prostate enlargement, or due to urinary infection, or diabetes is most common.
Need not be all prostate enlargements need not be cancer.
Yes, need not be cancer. Aging is normal, benign enlarged prostate. Aging is the.
And above 60, every male should go for examination, no?
PSA test.
PSA
prostate specific candidate.
Every 2 years.
Every year.
Every year. Okay. That is good.
Prevention.
For prevention. Okay. And nowadays, what we feel is that there are a lot of dialysis patients.
Yes.
Lot of dialysis patients. And what is the reason for this kidney failure among?
Not reason. As you said, commonest is diabetes, hypertension, chronic CKD, chronic kidney disease also can cause.
Oh. Again, the silent killer is this hypertension and diabetes.
That can be prevented. That cause can be prevented.
Diabetes is the main problem for all these things, no?
No, I can say in another way. Diabetes is a disease of blood vessels.
Okay.
If it affects your eyes, it is called retinopathy. If it affects your brain, stroke. If it affects your heart, myocardial infarction. If it affects your blood vessels, diabetic the amputation like that, ulcers, all the things. If it affects nervous system, burning sensation of the feet and all the things. And if it affects the gastrointestinal, they will cause diarrhea, constipation. So it depends on the area it is affected, blood vessel.
What is the prevention for this, what we say, this killer, this disease?
Which diabetes?
Diabetes.
See, one is diet.
Diet. Okay.
Number one.
Can you suggest a diet?
Yes, I'll suggest. Diet, exercise, medicines. And diet means you can take, suppose if you are taking some food, 50% should be pulses.
Okay.
50% should be cereals. Pulses including vegetables and everything, dal and everything. Other things, what we are eating, Indians will eat 80 to 90% of carbohydrate, little protein. That is the diet. Instead of taking full meal, take limited amount number of times.
Okay.
Diet is very important.
This stomach should not be full.
That can be done by yoga exercises, walking every day. By walking every day, it will burn the calories.
Okay.
So blood sugar will come down automatically.
I used to swim every day.
Excellent.
Excellent. Swimming is an excellent exercise.
Yeah, it will affect every part of the body.
Okay. Full body exercise.
Yes, that's true.
Okay. We have got a pool, excellent pool here in Christ College.
Very good.
It is a social project of Christ College. And I am a life member there. I used to go there every day and swim for at least 45 minutes.
Great. That's good exercise.
Yeah.
That's why no belly, nothing.
Yeah, I was a little more fatty, but this dialysis, how can we prevent? Again, this diabetes is the result.
See, the causes are so many. I said chronic kidney disease, I told you, and the causes this one. Dialysis, they have to take, there are two types of dialysis. Hemodialysis, that is blood. Peritoneal dialysis, they will pass the fluid inside. Peritoneum, abdominal cavity acts as a dialysis machine. So they will keep fluid inside. All waste material will come down. That water is removed. Again, fresh saline will be put into the stomach. That is two types of things are there. Probably at least they have to require 3 times in a week. Best method is transplant, kidney transplant. Kidney transplant may give good life.
Okay. One thing, last question, sir. Your son is a nephrologist,
Yes.
no? And he is working in Apollo Hospital.
Yes.
I think he might have done a lot of surgeries, no? He's a
We are not a surgeon. Transplant physician means
transplant physician. Okay.
what they will do, they will prepare it.
Okay.
They will do, but maintenance and preparation is
Okay.
important.
Okay. Okay. And almost there is 100% success for this transplantation, no?
Depends on the techniques and these things. See, previously they are doing close relatives like that, group like that. They are doing, other people also they are doing
Okay.
cadaver transplant and other things.
Transplantation is working out in majority of cases.
Yes.
No? We can't go with the dialysis, no? Because I have seen so many, because everything is rationing. When we start dialysis, they cut your water consumption to a small quantity of water in 2 days.
No, the idea is kidney control the whole body.
Okay.
That is
In normal person.
homeostasis.
Okay.
Suppose if people drink more, it will pass more, less urine. See, when the kidney is affected, load will become more if you drink water. That's why they restrict water.
Oh.
Required amount of water.
Healthy living means we are having a good urination and regular motion, no?
No, not like that. We require physical and mental health both.
That is what World Health Organization has
That's
defined.
both are important, not that.
World Health Organization has defined health as
Health for all.
a peculiar state of mind and body.
Yes,
Mind and body is related. And I am with yoga for the last 9 years.
Most important, I believe I am a Gandhian. If you are truthful, Chedu Venaku means don't listen bad words, don't see bad words, don't talk bad words. That will do you a lot.
Okay.
3 monkeys. It was
Yeah.
given by Rabindranath Tagore to Gandhiji. It is a
That
Chinese-
picture was presented?
I will have 3 monkeys in my room.
Yeah.
Actually, that is given by to Rabindranath from Chinese.
Okay.
So what they do in China, for gift every time after their birth, they will give gift to their children to become good citizens.
Don't utter bad words. Don't hear bad words.
Don't see bad words,
Don't see bad things.
bad things. Don't do bad to others. You can add. Don't think bad.
That is the most problem that I may be facing because I cannot.
If you are doing like that, you will be happy.
Okay. Anyway, nice to meet you, sir, and had a nice meeting.
Thank you.